The most common request I get, unfortunately, isn't for eyelid surgery, facelift, because most patients really aren't sure what it is they need. The most common request is, what can you do about this? Which is a very vague question. And then even if they center around their mouth or eyes, I'll bring up the mirror immediately and ask them to tell me, what is it exactly that bothers you? Many people are mistaken thinking Botox and Dysport are fillers, when Botox and Dysport are actually drugs that paralyze muscles, that stop people from squinting and making the lines between the eyes, squinting and making the lines on the side of the eye, or raising the forehead and creating creases. Whereas fillers are materials, whether they be gels, pastes, or collagen stimulators, that are injected into areas that are deficient. For instance, the folds, the nasolabial folds, the marionette lines, or what we call oral commissures, the cheeks for cheek fullness, and a number of other locations, including the lips, most commonly probably. The first and most important thing is safety, and I always have to remind patients who's on the other side of that syringe. Unfortunately, the filler companies will sell the fillers to essentially anybody with 10 fingers and a license to practice some degree of medicine or nursing, and they really don't care whether you're getting a board-certified facial plastic surgeon or not. It's not a place to cut corners. So the first question is, how good is the person who's going to be injecting you? Secondly, there's an appropriate filler for every area. Let's talk about the lips, because people are really afraid to do lip injections, despite the fact it can be very straightforward and very rewarding. I personally don't think I have unhappy lip patients, because we always make sure that they like the result at the time of the procedure, and everybody's invited back in 2 weeks to be able to tweak the result if necessary. Many people are afraid of the pain, and essentially, as long as we take enough time with the topical numbing agent that we have, and some people will take a few extra strength Tylenol, as well as a gentle touch. I've drawn very few tears in the last 15 years. So I've heard terrible stories, I've seen terrible results, and unfortunately, most people extrapolate those results to all treatments, when in reality, lips can be a beautiful thing. And if you look on my personal Facebook site or on Spago's site, Love Our Lips is a common theme, and our patients I catch candidly on Facebook show how beautiful their lips are out and about. When it comes to safety with fillers, there's several advances, and there's several things that have just been acceptable practice for since they've been used. The first is to always cleanse the area appropriately to avoid infection, and to this date I don't know of a filler-induced infection in my practice. Secondly, we've made a huge advance in switching from using all needles to using something called injection cannulas. An injection cannula is essentially a way to place the filler into the skin with a blunt tip rather than a sharp tip on the end of a needle. So for a cannula, for instance, in the nasolabial fold, we take a tiny, small needle to make an entry hole. A small cannula is then placed into the fold, and because it's blunt, it can actually be used to undermine or lift the tissue before injecting, and also minimizes the chance of injecting into or breaking a blood vessel. Injecting slowly, injecting appropriate amounts at one time rather than over using the filler are also safety factors, because blood vessels can be crushed, and secondary complications are terrible. And I'd like to say that I've not had that in my practice, because I do practice safe injection standards. There's just no substitute for a nice soft touch and years of experience. The most common combination therapy is to use Pelivate, which is my skin tightening procedure, which I've used for 13 years successfully now, to shrink, so to speak, the skin wrapper, and then fill and restore volume. So a patient comes to me having lost volume either under the eyes with tired looking eyes, in the cheeks because of cheek hollows, or jowling because of loss of volume higher in the face. That's just allowed the skin to essentially fall down the skeleton. I take a two-prong approach to this because I have a very reliable way to tighten the skin, and that's with the Pelobate procedure. The procedure is a matter of heating the skin gradually rather than rapidly, so it's a painless procedure, applying heat to therapeutic temperatures that trigger new collagen production and the formation of infirming and smoothing the skin. We work to a point of maximal effect so that every patient is actually getting their maximal dose, so to speak, rather than having some kind of fixed dose, because other devices that zap the skin rather than gradually heat the skin have to be careful about how much they heat the skin. Then we look at where we're going to apply the filler. Have we flattened the nasolabial folds to be able to use less of a filler here and just fill the grooves? Have we reduced the marionette lines? Have we firmed and lifted the cheek so that we can add volume to the cheek but minimize the amount that we need? Oomph per ounce is the word I'd like to use. If we can shrink the wrapper some percentage, then apply the filler, you're going to get a lot more oomph per ounce with those small syringes of filler. Follow-up visits for filler, Botox, or Dysport injections are really pretty infrequent. I'll tell all of my patients who are getting Botox or Dysport that if there's any asymmetry, meaning one brow is a little pulling a little higher, or one wrinkle isn't quite exact like in my own forehead here, to come back and we'll touch it up within 10 to 14 days. In the case of filler, it's usually the fact that they'll look in the mirror and say, I think I want a little bit more. And the most common reason to have a 2-week follow-up with filler is to get a bit more in the areas that we treated. And of course, the only indication for an immediate follow-up is any kind of painful swelling, which is rare. But all patients are invited back for a follow-up. And then when it comes to maintenance, it really depends on what filler we're using and what area we're treating, and that's quite a long dissertation for another recording as to whether we're going to use something that lasts months, something that lasts years, and how it affects your face at your given age. So if you're interested in facial fillers or Botox or Dysport for wrinkles around the eyes and forehead, just call Spago at 941-205-3030 and make an appointment. Our consultations are at no charge, usually take approximately half an hour, and if we plan on it, you can actually have the injection done the same day as the consultation if it's appropriate.